This may look like a typical home, but it is actually a complete simulation, a training facility for caregivers hoping to learn more about how to care for our nation's rapidly growing senior population. The goal is to help older Americans with serious chronic illness or age-related ailments remain as independent as possible. At UC Davis, these unique simulator facilities help train medical staff, patients, and even families develop critical skills to give and receive quality care at home.
More and more, what you see in healthcare training is the use of simulation. And most of us would never dream of getting on an airplane unless the pilot had spent many hours in a flight simulator. The same thing now is really true of healthcare training. One of the trends that we're seeing in healthcare is that patients are being discharged home quicker and sicker, which means that the burden of caring for the kinds of patients that used to be cared for in hospitals now has fallen to families in home settings. In 1950, you used to have a 1 in 30 chance of being a family caregiver. By 2030, we expect that to be a 1 in 3 ratio, which is staggering. And part of that is probably also driven by patients wanting to be at home and not in hospitals. One of the benefits that we see out of the simulation spaces that we've created here in Betty Irene Moore Hall is that they benefit not just our students, but the health providers in our community, especially at UC Davis. We've done several scenarios around family caregiving. Several of them relate to families caring for someone with dementia, and it's really important for our students and the healthcare workforce to understand the challenges that families face. It will also be a space where we can bring caregivers in from the community or caregivers who may be having somebody discharged home.
20 million family caregivers often perform complex nursing and medical tasks with little instruction. Caregiver simulation can help.
You know, I went to nursing school to learn how to do things like catheters and IVs and complex medication regimens. Those are things that we typically teach family caregivers in a 10-minute visit as they're getting ready to walk their family member out the hospital door. One of the things that I also hope happens as a result of our educational programs is that we better educate health professionals about family caregivers. They are often the invisible member of the healthcare team.
In the past, family members were asked to leave the room when medical staff were providing care. But now there is an understanding of the need to be present to observe as a caregiver.
The goals of that institute are to prepare a healthcare workforce to better partner with family caregivers and to enhance the capacity of families to provide care.
This digital short is supported by UC Davis Health, home to the #1 ranked medical center in Sacramento by U.S. News and World Report. Learn more about their doctors and their passion for advancing health at health.ucdavis.edu.